Hey everyone, this is Your Health, where it's all about you. Today we're going to be talking about self-advocacy. Have you ever been in a hospital setting, maybe it's you and a loved one, and a doctor or nurse comes to you and tells you what the plan is, but you don't really have any tools for understanding what they might be explaining to you? Today we're going to talk about what it means to advocate for yourself in the healthcare system. I'm here with Dr. Bernard Ashby, established cardiologist, and he's going to kind of run down some of the numbers so that you understand how important this issue really is.
So I appreciate you, Ike. So just understanding how important advocacy is, I see it every day as a physician, that when patients come in and they're deliberate about why they're there, what they're looking for, that they get more out of those visits. And so you as a patient have to be thoughtful that you're a consumer and that you're your best advocate, and you have to take your own interests in mind. And actually, if you look at the statistics within healthcare, they're basically very much related to what's going on in the nation at large. And essentially, if you are poor, if you have less education, if you have less resources, your outcomes are poor. And so that's why you have to be your own advocate, because if you don't have those resources, so to speak, you're going to be at a disadvantage. So you have to speak up and come into the doctor's office or go into the hospital with a deliberate agenda, which is your healthcare, okay?
Okay, so you might be wondering to yourself, okay, how do I become an advocate for my own health, right? Like, where do I even start? And that's kind of the whole purpose of what Your Health is doing. What we do is we collaborate with churches in the community, and we've devised a health literacy curriculum. So basically, you go to church for your spiritual health, and also while you're at church, you can get some insight on how to manage your physical health and advocate for yourself in the hospital or clinic setting. But before we hop into that, what we really want to do is understand how our community comes to learn about their healthcare information. You guys go to the hospital, get information, and go on WebMD? Do you call your auntie, your uncle, your cousin who knows a doctor from, 10 years ago because they graduated from the same high school? I don't know how you go about doing it, but we really want to find out.
So this is basically a two-sided issue. And if you look at it from the perspective of the patient, they may have an inability to communicate with their provider. And if you look at it from the perspective of the healthcare system or a doctor, they may have an inability to communicate with the patient. So what we're trying to do here with Your Health is trying to bridge that gap. And if you look at some of the determinants or things that are associated with poor outcomes, meaning that you die sooner or you're more likely to have a poor outcome with any disease. So if you have diabetes, if you have hypertension, you are more likely to do poor if you don't make as much money, if you're a woman, if you're a minority. And this is related to that gap in communication or engagement. And so with Your Health, with our curriculum, we're trying to bring the two together. And so we're proud to bring a full comprehensive curriculum to you. And I want you to stay engaged and look forward to our upcoming newsletters. Thanks.